Hello, my name is Erin Rooney, and this is a presentation on my research findings for my Capstone project for Colorado State University Global. My project is on COVID-19 symptoms and demographic severity impact. In late 2019, COVID-19, also known as the coronavirus disease, first began. Since then, there have been over 774,880,000 reported cases spanning over 189 countries. This disease overwhelmed hospitals and heavily impacted the healthcare system worldwide. My research project was to create advanced analytics models to allow for better public health interventions and improved efficiencies in the healthcare system. The public health intervention and education can allow the at-risk populations to utilize preventative measures in protecting themselves and others. There are two objectives to my project. The first is to develop and deploy multiple machine learning models aimed at predicting the severity of COVID-19 based on symptom profiles. And the second is to use advanced analytics techniques to examine how demographics influence disease severity. My research questions and hypotheses are: what type of model between k-means cluster and multiple logistic regression is more effective at determining the severity of COVID-19 based off the symptoms the individual experienced? The null hypothesis is that a clustering model is more effective than a regression model at determining the severity of COVID-19 based off the symptoms the patient experienced. The null hypothesis is that a regression model is more effective than a clustering model at determining the severity of COVID-19 based off the symptoms the patients experienced. For this research question, I created three models: a k-means clustering model, a logistic regression model with principal component analysis, also known as PCA, and finally a logistic regression model without PCA. To evaluate the k-means model, I used the silhouette score as well as the adjusted RAND index. To evaluate the regression models, I used the F1 score and accuracy. Starting with the k-means model, I used the cumulative explained variance to determine that 12 principal components, or PCs, would be appropriate. Then I used the elbow method to determine that 4 clusters would be ideal. The findings for the k-mean model were a silhouette score of 0.25 and an adjusted RAND index of 0. The silhouette score of 0.25 indicates fair clustering with some separation among the different clusters, but not enough to result in high predictive power. The resulting adjusted RAND index of 0 indicates that the points are essentially random. Overall, while the cluster model works for separation, it is not effective at predicting if symptoms can accurately identify the severity of individuals' COVID-19. Next, the multiple logistic regression with PCA results showed an F1 score of 86 for non-severe cases, but an F1 score of 0 for severe cases. This means that although the overall accuracy of the model was 75%, the model failed to predict the severe cases of COVID-19 and therefore would not be enough. The second multiple regression model, this time without PCA, had an accuracy of only 47%, but an F1 score for severe cases of 33, which is much better than the last model. However, none of the models received high enough scores, and none of the models performed well enough to have been considered for deployment, failing to reject the null hypotheses. The next research question and hypothesis are demographic factors such as age and gender significant indicators of if the patient will experience high severity COVID-19? The null hypothesis for this question is that demographic factors such as age and gender have a significant impact on COVID-19 severity. The alternate hypothesis is that demographic factors such as age and gender do not have a significant impact on COVID-19 severity. To evaluate this, I will look at p-values and odds ratios. First, I built a logistic regression model using age and gender. This initial model did not show any significant variables, with gender showing very little impact on severity of COVID-19 with p-values of 0.459. The second model I created excluded gender and only included age. This model also showed the variables did not have significant impact on the severity of COVID-19 with odds ratios of less than 1. However, the p-value for some of the ages were close to the 0.05 significance cutoff, indicating a potential weak association. Ultimately, for research question 2, I was unable to reject the null hypotheses. I do believe my research indicated that more research should be done on the impact age has on a patient's severity of COVID-19. This can be used as a starting point along with the inclusion of comorbidities and more detailed data. Thank you so much.